In the 1990s, a single pill promised to end chronic pain safely. It was prescribed to millions. It generated over $35 billion in profit, and it left behind 500,000 dead Americans. This is the story of how a pharmaceutical company did not just break the law. They rewrote the rules of medicine itself. This is buried truths. To understand Purdue Pharma, you have to understand the Sackler family. Specifically, you have to understand Arthur Sackler. Arthur died in 1987, before OxyContin was even created, but he is the reason the entire disaster happened at all. Arthur did not invent any drugs. He invented something far more powerful. He invented pharmaceutical marketing. In the 1950s, Arthur Sackler had a brilliant idea. Pharmaceutical companies were selling tranquilizers like Valium to doctors as dangerous drugs that only desperate addicts would use. Arthur's genius was simple. Rebrand them. Make them sound safe. Make them sound necessary. Make them sound like medicine for regular people with regular problems. He created an entire playbook. He paid doctors to speak at conferences. He published medical journals that he secretly owned. He advertised in medical magazines. He made addiction sound impossible. And it worked. By the 1960s, Valium had become the most prescribed drug in America. Millions of Americans had become addicted to something they thought was safe. Arthur Sackler died a billionaire, celebrated as a patron of the arts. His brothers, Raymond and Mortimer, inherited not just his money, but his playbook. In 1952, they bought a small pharmaceutical company called Purdue Frederick. For decades, Purdue manufactured OxyContin, a long-acting morphine pain medication. It was profitable but not revolutionary. Then something happened that changed everything. The patent on OxyContin was about to expire. Once it did, generic competitors would flood the market, and billions of dollars in profit would disappear. Purdue needed a replacement. They needed a new blockbuster drug, and they found it in a compound called oxycodone, an opium derivative twice as powerful as morphine. They called it OxyContin. The plan was to use Arthur's playbook to make the most powerful addictive drug ever created seem safe enough for grandmothers with arthritis. Here is the problem they had to solve. How do you convince doctors to prescribe an extremely powerful opioid when they have spent their careers terrified of creating addicts? The answer is simple. You lie. In 1980, 15 years before OxyContin was even approved, two researchers named Porter and Jick published a letter in the New England Journal of Medicine. It was just a letter, not a full study, but it contained a single claim that would change everything. Less than 1% of patients treated with opioids become dependent on them. That letter was based on incomplete data from a hospital setting. It was not designed to evaluate addiction, but Purdue Pharma saw an opportunity. They cited that letter thousands of times, in sales pitches to doctors, in medical journals they secretly funded, in advertisements. They took a casual observation from a single letter and transformed it into the foundation of an entire marketing campaign that claimed opioids were safe. When the FDA approved OxyContin in 1995, something suspicious happened. The drug was approved with a label claiming that the extended-release formulation would, quote, reduce the potential for abuse, end quote. In reality, Purdue knew that crushing or chewing the pills could bypass the release mechanism entirely. It never warned doctors or patients about this. The FDA examiner who approved the drug was a man named Curtis Wright. Within months of approving OxyContin, Wright left the FDA and joined Purdue Pharma. His new salary, $400,000 a year. But the real machinery of the conspiracy was the sales force. Purdue doubled its number of drug representatives, from 300 to 600. They targeted general practitioners, doctors with no specialty training in pain management. These were physicians who wanted to help their patients, but had never been trained in the dangers of opioids. Purdue's representatives offered massive bonuses, up to $100,000 a year for salesmen who pushed the highest doses. They sponsored, quote, pain management, end quote, seminars that were really just extended sales pitches. They distributed free samples, thousands of pills to be handed directly to patients. And they had a simple message. OxyContin is different from other opioids. It is safer. The extended-release formulation means it is harder to abuse. Patients need it. And if they are complaining about pain, it is because they do not have enough of it. Here is what actually happened in the real world. Purdue claimed that OxyContin lasted 12 hours. That was the entire marketing pitch. One pill every 12 hours and patients would be pain-free. For many patients, the effect lasted 8 hours, maybe less. When patients came back complaining that the pain was returning, doctors had two options: prescribe more frequent doses or increase the strength of each pill. Purdue had already made their decision. Doctors were instructed not to give more frequent doses. Instead, they were told to increase the strength. So a patient might go from 20 milligrams to 40 milligrams to 80 milligrams to 160 milligrams. This created something called pseudo-addiction. When a patient complained about needing more drugs, Purdue had a term for it. It was not addiction, they said. It was pseudo-addiction. The patient simply was not getting enough medicine. The solution was always the same: increase the dose. By 2000, OxyContin sales had reached $1.6 billion a year. Doctors were prescribing it for everything: arthritis, migraines, back pain, tooth pain. Patients were taking doses that would have made a serious drug addict hesitate. And then something started happening that Purdue had planned for all along. Patients became addicted, not in the way they imagined addiction, not in the way they were told was impossible, but they were addicted. The pills were expensive, $20 to $30 per pill when bought on the street. So addicted patients had a choice: keep buying pills at escalating costs or find something cheaper. That is when, quote, pill mills, end quote, appeared. Clinics that dispense thousands of pills a day for cash, no questions asked. In Florida, some pharmacies were ordering more OxyContin in a month than some states ordered in a year. Prescription pills appeared on the streets. In 2001, OxyContin became the most commonly abused prescription drug in America. People were crushing the pills and snorting them, dissolving them and injecting them, doing everything Purdue claimed was impossible. By the time authorities started restricting OxyContin prescriptions around 2010, millions of people were addicted. They had built up massive tolerances. Purdue's solution had created the problem. These addicted patients faced a choice: go through withdrawal, which is agonizing, or find another drug. Heroin cost less than OxyContin. It was easier to find. So millions of people transitioned from prescription pills to street drugs. Then, in the 2010s, heroin was displaced by fentanyl, a synthetic opioid 100 times more powerful than morphine. Fentanyl does not require a pharmacy. It does not require a prescription. A single grain, the size of a salt crystal, can kill you. The current overdose crisis did not start with fentanyl. It started with OxyContin. Purdue opened the door, and when that door was finally closed, patients had nowhere to go but deeper into the darkness. In 2007, something remarkable happened. Purdue Pharma pleaded guilty. They admitted to deceptively marketing OxyContin to doctors and regulators. They paid $634 million in fines. For a company making billions in profit, $634 million is a cost of doing business. It is what you pay when you get caught, and then you move on. Not a single Sackler family member was charged with a crime. For over a decade, lawyers worked on lawsuits against Purdue. Thousands of them. States, counties, cities, hospitals, everyone sued. The evidence was overwhelming. In 2019, Purdue Pharma filed for bankruptcy. It was a strategic move. Bankruptcy protection meant Purdue could settle all cases at once, on terms favorable to the company. In 2024, the U.S. Supreme Court heard arguments about whether the Sackler family could obtain immunity from civil liability. The family had already withdrawn over $10 billion from Purdue before the bankruptcy, moving the money into trusts and offshore accounts. On May 1, 2026, just days ago, Purdue Pharma officially ceased to exist. It was replaced by a company called Noah Pharma, designated as a, quote, public benefit corporation, end quote. The profits from Noah are supposed to go toward treating addiction. But here is the problem. The Sacklers kept the money. Over $10 billion extracted before the bankruptcy filing. In the settlement agreement, the family obtained what amounts to immunity from further civil lawsuits in exchange for $4.3 billion over time. The family that profited from 500,000 deaths negotiated their way to a settlement that protects their wealth. Raymond Sackler died in 2017 without facing criminal charges. Mortimer Sackler is still alive. The rest of the family continues to operate pharmaceutical businesses. They are banned from producing opioids, but they remain billionaires, and they remained largely untouched by the justice system. The OxyContin crisis fundamentally changed American medicine. Doctors became terrified to prescribe opioids at all, even to patients with legitimate severe pain who desperately need them. But the damage was already done. Over 500,000 Americans are dead. Millions more are addicted. Entire communities have been destroyed. Families have been torn apart. And the person most responsible, Arthur Sackler, who invented the playbook, had already died a celebrated billionaire, praised for his donations to museums and universities. The truth about Purdue Pharma was not hidden in classified documents or secret meetings. It was hidden in plain sight, in medical journals, in sales pitches, in the careful selection of data that supported their narrative while ignoring evidence that contradicted it. Buried truths is not always about conspiracies. Sometimes, it is about things that were hidden not because they were secret, but because everyone looked away. On May 1, 2026, Purdue Pharma ceased to exist, but the crisis it created will continue for generations. The question is not whether justice was served. The question is, why did it take 30 years and 500,000 deaths to even try? If this investigation matters to you, subscribe to Buried Truths. Every week, another corporate cover-up, fully documented and fully sourced. 500,000 dead, $35 billion in profit, zero accountability.